Hi friends, in today's episode of DAMS Unplugged, I'll talk about a newish kind of update in urinary tract imaging. Although, I would not exactly say it new, but it is from an undergraduate perspective or from a postgraduate perspective also, it's like an important thing today. Now, let me show you the image and the history here. This is a young man who comes to you with flank pain since 2 months, and you know flank pain, you are doing a non-contrast CT today to look out for any urinary tract stone, etc. So now this is the non-contrast CT of the abdomen. This is the structure that you see here that I'm pointing out is for you is the liver. This is your right kidney, this is your left kidney, this is your aorta, this is your IVC. This is a non-contrast CT. We have not given the IV dye here, but oral dye has been given. That is why the bowel loops are looking opacified. Now, when you look at this picture here, what are you able to see? Are you able to see a radio opaque area here and another radio opaque area lower down? So you are able to see renal calculi. So what do you think is the composition? So some of us, are tempted to say that, okay, this must be a calcium stone, not a uric acid stone because it is visible on a CT. But it is not true. Important thing to understand is that uric acid stones are radiolucent. They are not visible on X-ray. But that doesn't hold true for a CT. Looking at it, I cannot tell you that is this a uric acid or a oxalate stone. It could be either of the two. It could be a calcium stone. It could be a uric acid stone. You cannot say on a CT. The key take-home message that I want you to have is uric acid stones are CT visible. Okay. And today we have a technology called as dual energy CT, which could be a which also called it could be a single source type or a dual source type, but we are scanning the patient at two different energies, and we are looking at how the attenuation changes when we use different kVp of X-ray beams. Now, for a soft tissue, that difference is not too important, but when we look at structures like stone, that difference in attenuation that we see at two different energies is able to help us to characterize the stones. Now look at this two images in front of you. Can you see that stone is looking red while the calcified structures like bone are looking blue? Had it been a calcium stone, it would have been appearing blue. So when it is appearing red, it is not a calcified stone, so that means it is a uric acid stone. And when we look at the ratio of attenuation at different energies, we can find out where is the stone here, and we can divide. We can create a line which is dividing the non-uric acid stone from the uric acid stones, and these stones are lying below this line, telling us that this is a uric acid stone. So why it is so important to differentiate between a uric acid stone and a non-uric acid stone? Because of the management. Uric acid stones usually would be managed medically, while a calcium stone or a non-uric acid stones are usually towards the surgical management. And you can see that even today we are able to even differentiate between cysteine and hydroxyapatite and oxalate. We can even do that, but that is more narrow. The main goal of a dual energy CT when we use it in urinary tract is to find out, am I looking at a uric acid stone or a non-uric acid stone? And for the residents, it's important to see, had it been calcium stone, it would have appeared blue, just like the bones. Now here you see it is appearing red, and everything else which is calcified is looking blue. That tells us that we are looking at uric acid stone. So I hope you are able to understand the value of dual energy CT in urinary tract imaging. It has ability to differentiate uric acid stones from non-uric acid stone. And this is the same technology that we use to differentiate gout from pseudo gout, and we are able to find out if the crystals are made up of calcium pyrophosphate or uric acid. That is the value that dual energy CT brings to the table. I hope you enjoyed this episode of Unplugged. Do follow us on DAMSELE channel on YouTube and DAMSELE page on Facebook for more such updates. Do write back to me in the comment section if you enjoyed this episode, and do let me know if you want me to create any further topic for you in the Unplugged. Thank you very much.